Assalamualaikum warahmatullahi wabarakatuh. In this video, we will be presenting about psychological therapies. First of all, what is psychological therapies? Psychological therapies is a type of therapies in which a person with a mental disorder consult with a psychological professional. Psychotherapy consists of psychodynamic therapy, behavioral treatment approach therapy, cognitive behavioral therapy, and humanistic therapy. In this video, we will only look at the behavioral treatment approach, which is systematic desensitization. Systematic desensitization is a behavioral technique that involves gradually exposing a person to an anxiety-producing object, event, or location. It is a common technique used to overcome phobia. The process occurs in 3 steps. Firstly, do muscle relaxation activity. Secondly, constructing hierarchy of fears. The least should increase the severity of fears. For example, level 1 must be the least fear, and the most fear will be at level 3. Finally, gradually exposing patient to the fear according to the hierarchy by combining the relaxation activity until the fear is gone.
Hi, my name is Aina. I heard you're afraid of cats. But don't worry, because from today onwards, I will be guiding you through the process of overcoming your fear of cats.
I'm actually scared of them because they attack me with their nails.
It's okay.
Yeah.
Alright, so before we start our session, I'd like to teach you a breathing technique that you'll have to do before every session. So you'll have to take a deep breath and exhale through your mouth. Is that okay? Can you do that?
Alright.
Wonderful. Okay, so we'll start off by doing this. I need you to imagine that there's a cat in this room. What are your thoughts on it?
I'm a little shaky, but nothing too serious.
Now, I'll be showing you 5 different pictures of cats, and I need you to give them a score out of 10. Can you do that? So this is the first picture. How much would you rate it?
6.
This is the second picture.
5.
Alright. The third picture.
Definitely 7.
Okay. The fourth picture.
5.
And the fifth picture.
3.
Alright.
They're not as scary
Well
as
done.
I imagine. They're very cute and cuddly.
That's good. We're making progress. Okay, so today, actually, I brought a cat. But I'm only going to show it to you from a distance, and then I'll need you to rate how you feel, okay? How scared of you at a scale of 1 to 10. Okay? Okay, so how much would you
I'm
rate?
guessing 6. Although it doesn't try to hurt me, I'm still a little scared.
Today's session, we will be taking a step further in your process of overcoming your fear of cats, where I will be gradually closing the gap between you and the cat. Okay? Alright, okay, so, how do you feel?
Not okay.
Okay, make sure to take a deep breath. Okay, how do you feel?
Just a little scared.
Okay, we're making progress. And lastly, I'm putting it in front of you. How do you feel?
I don't like that it's new.
It's okay. I'll just let you get used to the presence of it right now, okay?
That's a good idea. Yeah.
Yes, well done. For today's session, I'd really appreciate it if you try and pet the cat. Is that okay? So, yeah? Can you try? Pet this
I suppose I could give it a shot.
Are you ready? Okay. Okay.
Wow, but it's so soft. Actually, I'm not nervous at all right now as I pet it.
Well, great job, Alesya. My job here is done. You've overcome your fear of cats, and I'm absolutely
Thank you for
proud of
getting me up to this point. Now I can go anywhere without worrying about cats.
Moving on to the very last part of this video, I will be talking about the history and the evolution of psychotherapy. So people who is suffering from mental disorder in the olden days might have thought to be possessed by evil spirits, and they receive inhuman treatment like exorcism. There was this place in London called the Bethlehem Hospital, which then is converted into an asylum, and it was considered to be a safe haven for the mentally ill. However, the name itself, safe haven, contradicts the real situation happening there. The treatment received by the patient was gruesome. Some received electroshock therapy, bloodletting, and ice baths. Fast forward from what we can see now, the treatment for mental disorders have evolutionized and it is more efficient than the older ones. So we have two types of treatments, which is psychotherapy and biomedical therapy. For psychotherapy, we have four different fields, which is psychodynamic therapy, behavioral treatment approaches, humanistic therapy, and cognitive approaches. However, therapists are more likely to use behavioral, cognitive, and humanistic, and leaving psychodynamic behind, because from what we know, psychodynamic is kind of like older version of this therapy. Under biomedical therapy, we have three types, which is drug therapy, electroconvulsive therapy, and the last one is psychosurgery. However, most therapists will consider giving a combination of psychotherapy and biomedical therapy in order to actually reach the effectiveness of the therapy given on the patients. I think that is all from our group, and thank you for watching, and I hope you enjoy it.